Good morning. This is Dr. Mark Cooper again, and I'm a psychologist working in the field of pain management. I've been doing that for many years. And I've done many videos before. I hope you've been able to have a chance to listen to a few of them. And today I want to talk about another strategy for pain management, and this is relaxation therapy. I'm going to talk about strategies for relaxation because relaxation really is not something that's necessarily normal for people, and especially if you have pain, you get into what we call a muscle pain tension cycle. So if you have pain starts, the muscles get tense, you get emotional to that, which causes more muscle tension, which causes more pain. So you can get into this vicious cycle between pain and muscle tension, and the emotions just add gasoline to that fire. So learning to relax is really a strategy that you really ought to learn to do if you've got chronic pain. And again, it doesn't come natural. Some people even think it's a waste of time, and they take it for granted that your body can just do that. But like, for example, some people wake up with a lot of tension when they wake up in the morning, and the sleep, they get non-restorative sleep. They don't get relaxed sleep. And so just because you go to sleep doesn't mean you're relaxing. So we're going to talk about a few strategies for doing that. Really the purpose of learning deep muscle relaxation is that it actually increases blood circulation and blood flow throughout the body. It lowers your blood pressure, lowers your heart rate, and it decreases the hypersensitivity of the nerves to at least some degree. And it also helps take out the emotional component of pain, which is sometimes a pretty good driving force for increasing pain. So there's some strategies that help you do this. The first, and there's some things you need to do in the beginning. And one is, it's best if you do your relaxation work in the same place and in the same environment and in the same body position and in the same chair, for example, because that sets that environment as the place to do this, and just the environment itself will let you get into the relaxation phase a little faster, and your body will be retrained to start getting relaxed just when you go into that area. Now, and the second one is you need to kind of tell your family members or other people in the family that this is the time that you're going to be doing this, and you don't want to be distracted. It's also helpful to get into a comfortable, semi-dark room where there's not a lot of outside noises. And if there is some noises out in the environment, sometimes just put a fan on that has the monotonous sound to it. Will kind of help you get into that environment. In fact, I have a fan every night when I go to sleep, and now I learned that if it's hard for me to go to sleep unless I have that little fan going on. So, but your body gets trained to certain things, and that's what you're doing here. You're conditioning yourself to get relaxed, and so those are the kind of general things that you want to get set up so you can be more efficient at your practice. So I'm going to talk about 4 steps. This first one is going to be what we call the muscle tension relaxation approach, and this was done by probably a guy named Jacobson and others in the psychological literature. You can go back and look at that. But basically what you do is you tighten up each muscle group, and you can start with your head to your feet, and you tighten it up, hold it for a few seconds, and then consciously let that body part relax. And so while you're sitting in a chair or lying on a mat or a floor, or however, let's start with your feet, for example, but you can start anywhere you want, whatever's best for you. Some people start with their hands by clenching their hands and then letting their hands relax and kind of feeling that tingling sensation that happens when that happens. But so you can, let's tighten your feet up first. Oh, let me go back and say one thing about this. If you have muscle spasms and cramps and have a tendency for those, or if you got a lot of nerve pain, I would suggest that you do one of the later strategies that I'm talking about rather than this one. But if you don't have a lot of muscle problems and stuff, you can try this one. So you tighten up your toes and pull them in, hold it for about 3 seconds, and then let them relax, and then pay attention to how that feels. And then the next step would be to tighten up your calves of your legs. You can do that by kind of pushing your heels into the ground and tighten it up, and then relax. But again, if you start getting cramps with this, it probably means that you might be a little deficiency in magnesium or potassium, and so you may need to go back and take some of that before you do this strategy, or go to one of the other strategies I'm going to talk about later in another video. Okay. So then you work up to your thighs of your legs, and you squeeze your thighs, and then let them relax, and then you squeeze your buttocks. Tighten, like squeezing like you're kind of hunching, and you just tighten up your buttocks, and then hold it for about 3 seconds, and then let that go. And then let's move toward your stomach, and you just like hold your stomach in, like you're getting ready to be punched in the stomach, or maybe somebody's going to step on your stomach, and you're getting ready to hold it, to do that. And you hold that position for a second, and then you let your stomach muscles relax. And then you squeeze your arms together, it's like you're squeezing your chest. You just kind of put your arms together like that, and squeeze your chest and hold that, and that gets your chest, and it kind of gets your arms at the same time. Then you take your arms on the chair or whatever you're sitting on, or the bed, and you just push down like you're kind of lifting yourself out of the chair, and that kind of tightens up the tricep muscles. Okay, and then the last step, or the next to last step, is you're going to grit your teeth. Just grit your teeth real forward. Hold that for a second, and then consciously let the muscles in your jaw just sort of relax. And then it's best to then pay attention to some breathing, and then take a slow breath to a count of 4, and then breathe out to a count of 4. Do that 2 or 3 times. And then you may have to go back through that whole sequence 2 or 3 times as your strategy. And that's what we call a muscle tension relaxation strategy. It helps kind of help you calm down. It doesn't take very long to do that at all. But you may have to go through it maybe 2, maybe 3 times to see if that's beneficial. Okay? And remember about the nutritional stuff, and remember about make food your medicine. And God bless you, and I hope this is helpful to you. And be watching for some more videos on the other strategies. This is Dr. Mark Cooper, and I'll talk to you later.